And up next, we have Alexandra. Looking forward to your question.
Yes, hello. Thank you very much. I will read your book. I just ordered it via Amazon. And before I have been on raw food mostly, but not totally. And I wanted to know if your protocol would also help people with, not with, I'm from Germany, my English is not so good, with arterias who are clogged, but who have chronic heart insufficiency due to chronic fatigue syndrome, ME, because I can barely move and so on. Would you say it also helps, or is it mostly for the arterias who are blocked? I think mine are pretty clear, but my heart seems to be very weak.
You know, with all due respect, I'm not sure that I'm fully understanding your question, and maybe our moderator would be willing to repeat the question.
Alexandra, just tell us one more time, if you can, briefly, specifically what the question is.
Yeah. Having from chronic fatigue syndrome, suffering a weak heart, but clean arterias, would your protocol help?
Okay. So the question is, you've got chronic fatigue, but they've done studies of your heart that shows that the blood supply to your heart is fine. And that is a part of your chronic fatigue. I'm not quite sure yet that I've heard how they measured that your heart was weak. Does that mean that it's the left ventricular ejection fraction is low?
We've actually, she's here. Okay,
not
good.
So far. I told my symptoms, and then the doctor just said, well, yeah, that's because of your chronic fatigue syndrome, and that was it. I only received ultrasonic of the arterias, which looked great, and that was it. So.
Well, I'm not, I rarely ever have questions in my practice about chronic fatigue, so I really would have to, in fairness, have you somebody who perhaps has an interest in that. But on the other hand, I can see absolutely no downside to your aggressively trying to eat, as we've discussed, with green leafy vegetables. I don't know that anybody would be against your eating the healthiest diet on the planet.
Thanks, Dr. Esselstyn. And next we have Pamela. Hi, Pamela. Oh, we saw you on mute for a second, but I think you went back on. If you can click that one more time, Pamela. Pamela?
Thank you. I'm here. Thank you. For your patients with cardiovascular disease, taking 6 times a day the greens, for how long must they do that? The rest of their lives? Or how do you measure when things are improved?
Well, no, I think you bring up an excellent point. But usually when patients their symptoms begin to resolve, and if they have a measurement that their disease is reversing, really, I think easily within a year or two, they could drop down to 3 or 4 times a day.
Thanks, Doctor. Up next, we have Lynn. Lynn, if you'd go ahead with your question, please.
Hi, thanks for all you do. I had a question in regards to fluoride toothpaste. If you don't recommend using that kind of toothpaste, what should we be using? And the second part of this is, I have very bad dry mouth because of medicine that I'm on. So my dentist also has me using a special toothpaste at night with fluoride in it. And I wear these mouth guards that I put some other fluoride stuff in it at night. So I'm kind of being, fluoridated to death here. So my question is, what should I be using if you don't recommend fluoride?
Well, I don't want to get in a wrestling match with your dentist, but you've asked the question is, are there toothpastes that do not have fluoride? And the answer is yes. I don't think I ought to be in a position of commercially pushing somebody's brand over another, but I would simply suggest that you go to Amazon, and as you look up toothpaste and look up those without fluoride, you'll find a number of brands, and I guess you can just choose the one that you like that tastes correctly for you. I can't help you with these other dental obligations of products that contain fluoride, but I think just if the other situation begins to resolve and you can get rid of those fluoride products, then it probably will it'll work better for you. Because as you probably know, I'm doing whatever we can to help people who are deficient in nitric oxide to find a safe way to gain it.
Thanks, Doctor. Up next, we have Francis. If you'd go ahead and unmute yourself, please.
Hi, Doctor. Thank you for all your great information. I have some questions about the mechanics of the chewing the vegetables. You said to just sprinkle a drop or two on the vegetables of the vinegar. Can you use more? Is there
yeah, several drops. I wouldn't flood it with it, no. But I mean several drops, because as you remember, the reason for this is the acetic acid from those vinegars has shown to restore the nitric oxide synthase enzyme that is contained within the endothelial cell and responsible for making nitric oxide.
Thanks, Dr. Esselstyn. Up next, we have Stephanie. Hi, Stephanie. Looking forward to your question.
Hello, Dr. Esselstyn. Thank you for the awesome presentation. So for heart patients, would you, how do you feel about calcium channel blockers, beta blockers, and salt? Should all be avoided or weaned off of?
Well, I'm not a great fan of medications, because when you think about it, none of the medications have anything to do whatsoever with the causation of the heart disease. However, there may be some other indications that are appropriate. But when you are eating whole food plant-based nutrition, and if your left ventricular ejection fraction of your heart is in the normal range, and other things being equal, I try to be your own advocate and ask your doctor precisely why it is that you're taking that medication, and see if you can't sort of, work together to see if you can't either cut the medications in half if you don't like the side effects, or maybe even reduce them and eliminate them, and see how you do without them. But also be sure you're eating whole food plant-based nutrition to optimize the function of your heart. Yeah.
Thanks, Doctor. Up next, we have, and I hope I'm pronouncing this correctly, Vijaya?
Yes. Hello?
Hi, welcome. We can hear you.
Yes, thank you very much. Doctor, this question regarding my husband. He is a diabetic 62, and all his functions like liver, kidney, thyroid functions are normal. HDL is in 56, vitamin D is also 66. So I would like to know, he has a high lipoprotein that is 200 last year, and this year it is 230. So how he can reduce that, and does that mean he has a heart disease? Thank you.
Well, let me see if I've understood the question. Yeah, I'm not sure I heard what your husband weighs. What his weight is?
If you can go ahead and unmute yourself one more time, let us know what your husband's weight is.
He weighs 180 pounds and 5'9" tall.
Right. Yeah, he could probably lose about 10 pounds. But again, I think most of the diabetic parameters are going to come into line when he's eating plant-based nutrition. Maybe I think he could lose another 10 pounds, maybe 15, and that would really begin to further, I think, make his numbers be a little bit more optimal. As far as an LDL cholesterol of 230, you'd like to really see a diarrhea, because I didn't hear whether your husband was eating whole food plant-based nutrition and still having an LDL cholesterol of 230. That's really rather unusual. And what I usually do with these patients is I carefully go over a diet diary first, see how many times they are eating out at restaurants and so forth, and then see if we can't really tie down all the loose ends. Then, if everything else being equal, you may want to think about trying a statin medication. Another thing that seems to help to lower that cholesterol is maybe several teaspoons of several tablespoons of flaxseed meal, and also the gooseberry powder, that is amla, AMLA, amla powder.